Unfortunately, therapy is pretty much non-existent for the homeless population because it's not covered under most guidelines, and that means that most of the homeless population who does address their mental health issues is purely looking at a medicated answer, and medication and taking medication is such a stigma for a lot of us who are housed and live in polite society. Taking medication is also a stigma in the homeless community, especially if it's medication, which a lot of mental health medication causes drowsiness. If you're sleeping under a bridge and people are constantly trying to take your stuff or might be trying to touch you or any other sort of thing that might happen to you while you're too asleep to fend for yourself, makes it really unappetizing to take any sort of medication that causes drowsiness, and many of the mental health medications do. So that medication piece, plus the part about not really having access to therapy of any kind, when almost every person experiencing homelessness has endured some sort of trauma, and some would argue are experiencing trauma every single day, to not have access to any sort of counselor or any sort of therapy options in addition to the medication is really kind of like shorthanding the response right from the start. And if you've been on mental health medications, you know that usually the doctor will prescribe something, and then within a few weeks they'll see how it's going to see if they need to readjust it. And with the homeless community, because of the quantity of people being seen, there's a lot of scripts being written, and then it's difficult to get them changed or observe changes to be able to create better prescriptions. The biggest challenge is that for many of our folks, the odds of them making it to the end of a prescription are virtually nothing. I would say it's probably 1 to 5% of the homeless population makes it to the end of a prescription, because there's so many things working against you.